Mr. Rothenberger, hi, Chris Westfall here. We haven't spoken in a while. I know I got your last email just before the holidays. I understand you just spoke with Rick, and your concern is the pre-existing conditions. I want to show you something that you are supposed to have taken a look at. I'm not sure if you have yet. Actually, I think it's where you derived some of your skepticism before. It's a book called 2013 Choosing a Medigap Policy. I say 2013 because the 2014 has not arrived yet. I'm going to show you what this document looks like right from the Medicare computer. It's on the screen right now. Choosing a Medigap Policy. And what I want to direct your attention to, now listen, we've only done this thousands of times in 18 years, and now we have 1,200 agents across the country doing the same thing. So I think we're kind of getting the hang of this, and have never had a complaint against us in all of 18 years because these plans are identical. So just bear with me for a second. I want to show you something on page 15 of the Choosing a Medigap Policy book. And it says right here, pre-existing conditions. That's what it's talking about right now. And it says there's a look-back period of 6 months if you had no coverage before. What you have is what's called creditable coverage. Creditable because you've been on the same exact plan. So what it says here is if you have had at least 6 months of continuous prior creditable coverage, which you have, the Medigap insurance company can't, contraction for cannot, make you wait before it covers your pre-existing conditions. So any Medigap policy that you have is considered creditable coverage, especially if you're on Plan F to Plan F, Plan G to Plan G, they're all exactly the same. And I just want to encourage you to do the research on your part just to find out that they're exactly the same. I read you the 5 health questions from New Era. The way it works is this. When we qualify somebody because they answered no to having a heart attack, stroke, or cancer, and then they wait for 6 months or a year, usually the only time we hear back from them is after they've had now a heart attack, stroke, or cancer. Those are the biggest things that prevent somebody from moving to a better value plan. Your agent should be shopping this plan for you every single year to make sure you've got the best value, because the standardized plans are standardized. They're exactly the same. And if you bring with you 6 months of creditable coverage and then you join a new company, there are no pre-existing conditions that they can even look at. There's not even a mechanism in the carriers to flag a potential pre-existing condition. You know why? Because they're all electronically paid claims. Whether we put you with Mutual of Omaha, Bankers Life, AARP, New Era, whoever has the best value for you, they all function the same. They do not exclude. They cannot deny a claim and say, wait a minute, let's pull out that electronic process that's automatic and let's get a human being in there to make a claims-paying decision. There's not a human being in there. See, Medicare pays the 80%. The supplement automatically pays the 20% when Medicare pays the 80%. That's a bifurcated claim. It goes to 2 different places at once Medicare gives its approval. So if it's a Medicare-approved claim, the company cannot deny the claim. They simply can't because it's approved by Medicare. Now, if you go have a facial or some tummy tuck or something like that, Medicare's not going to pay the 80%, so the supplement obviously is not going to pay the 20%. And what I just described to you is the same no matter which company you select. I mentioned to you before, and Rick has many times, we're an independent brokerage. We don't care which one you go with. New Era right now has the best value for you, and yes, the longer that you wait, the higher the rates will go up. A rising tide lifts all ships. All the rates will go up. And what I would just encourage you to do is continually chase the lowest rate, understanding that as long as your health qualifies you to move, you should move when there's a better value for you. Your agent, if they're honest, will tell you you should go to the lowest price plan. You know, it's kind of like a game of musical chairs. You can get up and go find a better chair every year until your health no longer allows you to do so. And even if it does, after I've worked with New Era now for a few years and I've seen their rate increase history, I would much rather have you with New Era than I would Bankers Life, just solely based on their rate increase experience. Wouldn't you? So I encourage you to reset that rate. Take an application. You've got all kinds of provisions that protect you. You've got a 30-day free look provision. You've got 30 days to go back to Bankers Life if you don't want it. You've got the protection from the state. You've got protection from the carrier and from the federal government because it's a Medicare standardized program. We don't want to screw you over, sir. We want to save you money. That's our job. That's why we get paid the big bucks. We help people save money. But it's the same exact plan. You already had the frustration of dealing with bankers on trying to get back your unearned premium, and they wouldn't help you there. Why would you want to stay with a company that has such poor customer service that they won't return your unused premium upon demand? All the companies I deal with would, and I was honest enough to tell you, you'd have that trouble with bankers, and I was right. So, I'm right about this too. Look at your own Choosing a Medigap policy book. I'll send you one if you don't have one. We've got a few hundred laying around our office. And just look at page 15 here, where it very, very clearly says if you've had coverage for 6 months, they can't even ask the question about a pre-existing condition when it comes time to paying your claim. And the truth is, there's nobody in the office to do that. They pay these claims through computers now. It's all the same thing. If your health still qualifies you to say no on those health questions, that's all there is to underwriting. I encourage you to get the new savings in place. You're no longer bound by that unearned premium with bankers unless you just send them another big fat check. We could try to help you get that back, but as you know, that's always fun dealing with bankers. Have a great day. Our number is 800-729-9590. It's up there on your screen. Take care, sir. Bye-bye.
Seniors are experiencing rate increases with their Medicare supplement plans at an alarming rate. Our goal at the Senior Savings Network is to shop the entire market for you to bring you the very best value for your insurance premium dollar. All Medicare supplement plans are equal. It's the law. Let our free service find you the best premiums for the plan you're on right now. You can keep the same doctor, same hospitals, just with a lower rate each and every month. Let us go to work for you.